Medical Assistant Exam Crash Course. Question 1. Before the visit continues in a patient intake station, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Apply electrodes directly over lotion. Option B. Use tape only and skip electrodes. Option C. Move all chest leads to the abdomen. Option D. Clean and dry the skin before applying electrodes. The correct answer is option D. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Incorrect lead placement changes the tracing and may impair interpretation. Question 2. Before the visit continues in an urgent care office, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 1 milliliter. Option B, 0.5 milliliter. Option C, 10 milliliters. Option D, 5 milliliters. The correct answer is option B, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 1 milliliter would provide 100 milligrams. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 5 milliliters would provide 500 milligrams at this concentration. Question 3. Following office protocol in a primary care office, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Stop and resolve the discrepancy before proceeding with care. Option B. Correct the date of birth without asking anyone. Option C. Use the appointment time as the identifier. Option D. Continue if the last name matches. The correct answer is option A. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. A last name alone does not rule out an identity error. Question 4. After reviewing the situation in an electronic health record review, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Tell the patient that questions are not allowed. Option B. Pause administration and verify the order and medication. Option C. Document that the patient was difficult and continue. Option D. Give the medication quickly before the patient refuses. The correct answer is option B. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Patients should be encouraged to participate in safety. Labeling the patient does not resolve the possible medication issue. Rushing increases risk and ignores a safety concern. Question 5. While working in an electronic health record review, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Appropriate marketing. Option B. Breach of confidentiality. Option C. Quality control testing. Option D. Routine scheduling. The correct answer is option B. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Question 6. While working in a walk-in clinic, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A. Tell the patient not to call if symptoms worsen. Option B. Avoid documenting that instructions were given. Option C. Review the provider-approved instructions and confirm understanding. Option D. Create new instructions that contradict the provider. The correct answer is option C. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patients should know when and how to seek help for concerning symptoms. Patient education should be documented according to policy. Instructions should match the provider's plan and office protocol. Question 7. After reviewing the situation in a walk-in clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Ask respectful questions and avoid judgment. Option B. Refuse to document relevant information. Option C. Tell the patient the practice is foolish. Option D. Assume all people from that culture act the same. The correct answer is option A. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Question 8. Before the visit continues in an infection control audit, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Leave the specimen uncovered at the front desk. Option B. Shake the specimen vigorously for 1 minute. Option C. Place the tube in direct sunlight to warm it. Option D. Wrap the specimen in foil or use an amber container as directed. The correct answer is option D. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Vigorous shaking can hemolyze blood specimens. Sunlight can degrade light-sensitive specimens. Question 9. After reviewing the situation in a diagnostic testing area, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Axon. Option B. Alveolus. Option C. Ureter. Option D. Platelet. The correct answer is option A. Axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. A platelet is a blood component involved in clotting. Question 10. An office review in an electronic health record review shows that a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Procedure code and diagnosis or reason for the service. Option B. Only the assistant's initials with no service information. Option C. Only the patient's favorite color. Option D. Only the room number. The correct answer is option A. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Room numbers do not describe the service or diagnosis. Question 11. A medical assistant is working in an exam room when a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A. Warm the finger or choose a better perfused site. Option B. Ignore the waveform and record the lowest value. Option C. Increase oxygen without reporting the finding. Option D. Place the probe over wet nail polish. The correct answer is option A. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. Question 12. Following office protocol in a medication administration visit, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B. Movement can create artifact that makes the tracing harder to interpret. Option C. Electrodes are used only to deliver medication. Option D. A movement changes the patient's blood type. The correct answer is option B. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Question 13. As part of exam preparation in a medical office workflow, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Acknowledge the frustration and provide a realistic update. Option B. Tell the patient to calm down or leave. Option C. Ignore the patient until the appointment starts. Option D. Blame the provider in front of the patient. The correct answer is option A. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Commands can escalate conflict and harm patient rapport. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Question 14. While working in a patient intake station, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Discard the result because it is abnormal. Option B. Tell the patient the exact diagnosis without provider review. Option C. File the result for review at the end of the month. Option D. Notify the provider or designated clinical staff promptly. The correct answer is option D. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Question 15. As part of exam preparation in a clinical skills review, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A. Round weight to the nearest 10 pounds. Option B. Record height only because weight changes often. Option C. Record the measurements using the unit required by the office protocol. Option D. Use the parent's estimate if the scale is nearby. The correct answer is option C. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Question 16. While working in a procedure setup, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Slow heart rate. Option B. Inflammation of the liver. Option C. High blood sugar. Option D. Fast breathing. The correct answer is option A. Slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. High blood sugar is hyperglycemia. Fast breathing is tachypnea rather than bradycardia. Question 17. While working in a primary care office, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Around. Option B. Above normal or excessive. Option C. Between. Option D. Below normal. The correct answer is option B. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Around is indicated by peri. Between is indicated by inter. Below normal is indicated by hypo. Question 18. An office review in a pediatric clinic shows that the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Patient seems dramatic about ear pain. Option B. Patient reports sharp right ear pain for 2 days. Option C. Ear infection diagnosed today. Option D. Right ear normal after exam. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Subjective judgment is unprofessional and not appropriate for the medical record. A diagnosis should not be documented by the assistant unless the provider has made it. Exam findings belong to the provider and are not the chief complaint. Question 19. In a treatment room, a complete blood count is ordered. Which tube is most commonly used? Option A. Light blue tube with sodium citrate. Option B. Red tube with no anticoagulant. Option C. Gray tube with fluoride oxalate. Option D. Lavender tube with EDTA. The correct answer is option D. Lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Sodium citrate is used mainly for coagulation studies. A red tube allows clotting and is not the standard choice for a complete blood count. Gray tubes are used for tests such as glucose or lactate depending on protocol. Question 20. A medical assistant is working in a treatment room when the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Urinary bladder. Option B. Gallbladder. Option C. Thyroid gland. Option D. Appendix. The correct answer is option C. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The appendix does not produce thyroid hormone. Question 21. At the start of care in a phlebotomy station, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A. Ask another patient in the waiting room to consent. Option B. Assume all minors can consent to every service. Option C. Follow state law and office policy for consent requirements. Option D. Refuse all care without considering exceptions. The correct answer is option C. Follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Other patients cannot provide consent for the minor. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Question 22. At the start of care in a walk-in clinic, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Surgical removal. Option B. Visual examination. Option C. Abnormal softening. Option D. Inflammation. The correct answer is option A. Surgical removal. Ectomy means surgical removal of a structure. Visual examination is often indicated by scopy. Abnormal softening is indicated by malacia. Inflammation is indicated by itis. Question 23. While working in a quality control review, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A. Use the instruments if the package is dry. Option B. Open the package and rinse the instruments. Option C. Write a new date on the package. Option D. Reprocess the instruments before use. The correct answer is option D. Reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 24. While working in a telephone triage workflow, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Snellen chart. Option B. Tourniquet. Option C. Hemostat. Option D. Autoclave tape. The correct answer is option A. Snellen chart. A Snellen chart is used to screen distance visual acuity. A tourniquet helps locate veins for blood collection. A hemostat clamps tissue or small objects during procedures. Autoclave tape indicates exposure to sterilization conditions. Question 25. During a quality control review, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Sterilization is the same as hand washing. Option B. Packaging instruments makes cleaning unnecessary. Option C. Disinfection always destroys every spore. Option D. Organic material can interfere with sterilization. The correct answer is option D. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Hand washing reduces microbes on skin but is not instrument sterilization. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Question 26. A medical assistant is working in an administrative check-in area when a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Use it because the cap is still attached. Option B. Guess the opening date from memory. Option C. Mix it with another vial to avoid waste. Option D. Follow facility policy and do not use it if safety cannot be verified. The correct answer is option D. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. Question 27. Given the workflow in a community health clinic, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A. Lavender tube. Option B. Light blue tube. Option C. Green tube. Option D, gray tube. The correct answer is option C, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Lavender EDTA is typically used for hematology testing. Light blue citrate is used for coagulation testing. Gray tubes are often used for glucose-related testing depending on protocol. Question 28. A medical assistant is working in a diagnostic testing area when a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, Sims. Option B, supine. Option C, Fowler. Option D, a prone. The correct answer is option B, supine. Supine means lying on the back facing upward. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Prone means lying face down. Question 29. While working in a certification exam scenario, a tickler file is used in the office. Which purpose does it serve? Option A, measure oxygen saturation. Option B, sterilize instruments. Option C, draw blood into tubes. Option D, track future follow-ups or reminders. The correct answer is option D, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Question 30. In a treatment room, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A, superior vena cava. Option B, aorta. Option C, pulmonary vein. Option D, pulmonary artery. The correct answer is option D, pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The superior vena cava returns venous blood to the right atrium. The aorta carries oxygenated blood from the left ventricle to the body. Pulmonary veins return oxygenated blood from the lungs to the left atrium. Question 31. At the start of care in a medication administration visit, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, cover it with loose papers. Option B, ignore it because it is not in an exam room. Option C, wait until a patient reports slipping. Option D, place a warning sign and arrange cleanup immediately. The correct answer is option D, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Question 32. After reviewing the situation in a women's health clinic, a patient asks which body system includes the skin. Which system should be identified? Option A, respiratory system. Option B, urinary system. Option C, integumentary system. Option D, endocrine system. The correct answer is option C, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 33. For a patient encounter in a primary care office, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, prepare the skin according to protocol to improve electrode contact. Option B, place electrodes over clothing. Option C, wet the electrodes with tap water only. Option D, ignore loose electrodes if the tracing prints. The correct answer is option A, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Electrodes must contact skin to record electrical activity. Unapproved moisture does not replace proper skin preparation. Loose electrodes can create artifact and poor quality results. Question 34. While working in a patient intake station, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, perform it because any provider request is automatically legal. Option B, document that the patient requested it and proceed. Option C, clarify the concern and follow legal scope of practice requirements. Option D, ask another assistant to do it secretly. The correct answer is option C, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Delegation does not make a prohibited task legal. Patient request does not override scope of practice limits. Passing on an improper task does not resolve the legal issue. Question 35. During a procedure setup, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Discard the tracing to avoid alarming the patient. Option B. Give the tracing to the provider promptly according to protocol. Option C. Change the tracing to make it look normal. Option D. Diagnose the rhythm for the patient. The correct answer is option B. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Question 36. At the start of care in an outpatient laboratory, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, PA. Option B, IM. Option C, subcut. Option D of 4. The correct answer is option A, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. 4 means intravenous and refers to administration into a vein. Question 37. While working in a pediatric clinic, the term hypertension appears in the problem list. Which meaning is correct? Option A, high blood pressure. Option B, joint inflammation. Option C, slow breathing. Option D, low blood glucose. The correct answer is option A, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Joint inflammation is arthritis. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Question 38. In an electronic health record review, a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, deductible. Option B, adjustment. Option C, copayment. Option D, premium. The correct answer is option C, copayment. A copayment is a fixed amount the patient pays for a covered service. A deductible is the amount the patient pays before insurance begins paying according to the plan. An adjustment changes the billed amount based on contracts or corrections. A premium is the amount paid to maintain insurance coverage. Question 39. During a women's health clinic, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right insurance, right copay, right appointment, and right room. Option B, right patient, right medication, right dose, right route, right time, and right documentation. Option C, right color of vial and right storage shelf. Option D, right diagnosis only. The correct answer is option B, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Administrative details do not replace medication safety checks. Vial appearance and shelf location are not sufficient medication rights. Diagnosis alone is not enough to confirm safe administration. Question 40. Before the visit continues in a clinical skills review, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, safety data sheet. Option B, appointment reminder template. Option C, insurance remittance advice. Option D, patient intake form. The correct answer is option A, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Question 41. To protect safety in a phlebotomy station, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A, ignore all provider instructions about inhalers. Option B, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option C, eat a heavy meal immediately before every test. Option D, wear tight clothing that restricts breathing. The correct answer is option B, Follow pretest directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Restrictive clothing can interfere with respiratory effort. Question 42. A medical assistant is working in a patient education session when a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Open the tube and stir with a swab. Option B. Leave the tube unmixed until pickup. Option C. Shake the tube forcefully. Option D. Gently invert the tube the required number of times. The correct answer is option D. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 43. At the start of care in a procedure setup, a patient is placed lying face down for a back examination. Which position is being used? Option A. Prone. Option B. Lithotomy. Option C. Fowler. Option D. Supine. The correct answer is option A. Prone. Prone means lying on the abdomen with the face downward. Lithotomy involves legs in stirrups for certain pelvic procedures. Fowler is a seated or semi-seated position. Supine means lying on the back. Question 44. A medical assistant is working in a clinical skills review when the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Protein in the stool. Option B. Sugar in the blood. Option C. Air in the lungs. Option D. The blood in the urine. The correct answer is option D. Blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Air in the lungs is not described by hematuria. Question 45. As part of exam preparation in a walk-in clinic, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Assume the patient cannot participate. Option B. Shout from another room. Option C. Face the patient and speak clearly at a moderate pace. Option D. Cover the mouth while speaking. The correct answer is option C. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Question 46. After reviewing the situation in a specialty referral visit, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Report and correct the filing error according to policy. Option B. Leave it because both patients use the same clinic. Option C. Delete the form and tell no one. Option D. Ask the patient to sign a blank form. The correct answer is option A. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Question 47. A medical assistant is working in a primary care office when a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Delete the original note completely. Option B. Ask a coworker to change it under their login. Option C. Ignore the error even if it affects care. Option D. Make an addendum according to office policy. The correct answer is option D. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Deleting a signed record can destroy the audit trail. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Question 48. In a community health clinic, a patient wants information released to a spouse. Which documentation is usually needed? Option A. A note written by the assistant after the fact. Option B. No documentation because spouses always have full access. Option C. A verbal request from the spouse only. Option D. A valid authorization or permission according to office policy. The correct answer is option D, a valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Authorization should come from the patient or legal authority. Relationship alone does not automatically grant full access to records. The spouse's request alone may not authorize release. Question 49. A medical assistant is working in an urgent care office when the assistant reinforces instructions for a Holter monitor. Which point is important? Option A. Remove electrodes whenever symptoms occur. Option B. Keep a diary of symptoms and activities as instructed. Option C. Ignore the return time. Option D. Submerge the monitor in water. The correct answer is option B. Keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Water can damage the device and create safety risks. Question 50. For a patient encounter in a pediatric clinic, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A. Oxygen saturation and pain score. Option B. Pulse and respirations. Option C. Height and weight. Option D. Blood pressure and temperature. The correct answer is option C. Height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Pulse and respirations are vital signs but are not used to calculate body mass index. Blood pressure and temperature do not determine body mass index. Question 51. Given the workflow in a cardiology practice, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Filter lymph. Option B. Create antibodies as their main role. Option C. Produce bile. Option D. Transport oxygen. The correct answer is option D. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Bile is produced by the liver and stored in the gallbladder. Question 52. Given the workflow in an outpatient laboratory, the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Ventricular repolarization. Option B. Ventricular depolarization. Option C. Kidney filtration. Option D. Atrial depolarization. The correct answer is option D. Atrial depolarization. The P wave represents electrical activation of the atria. Ventricular repolarization is represented by the T wave. Ventricular depolarization is represented mainly by the QRS complex. Kidney filtration is unrelated to electrocardiogram waveforms. Question 53. During a community health clinic, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. State the full diagnosis loudly to confirm the visit. Option B. Place all charts open on the counter. Option C. Ask other patients to help verify the record. Option D. Speak quietly and avoid announcing sensitive details. The correct answer is option D. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Open charts may expose protected information. Other patients should not be involved in private verification. Question 54. At the start of care in a clinical skills review, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Sterile technique. Option B. Chain of custody. Option C. Prior authorization. Option D. Patient confidentiality. The correct answer is option D. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Chain of custody concerns specimen handling documentation, not public conversations. Prior authorization concerns payer approval for services. Question 55. Given the workflow in a medical office workflow, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Leave the patient uncovered until the provider arrives. Option B. Skip explanations because the patient signed in. Option C, provide appropriate draping and expose only the area being examined. Option D, discuss the patient's body in the hallway. The correct answer is option C, provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Patients still need respectful communication during preparation. Public discussion can violate privacy and professionalism. Question 56. An office review in an exam room shows that a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The temperature will be elevated. Option B. The blood pressure may read falsely low. Option C. The blood pressure may read falsely high. Option D. The pulse oximetry reading will be inaccurate. The correct answer is option C. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Cuff size does not directly determine oxygen saturation accuracy. Question 57. When a patient encounter unfolds in a diagnostic testing area, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, wait for the provider before starting any response. Option B, give oral medication before checking responsiveness. Option C, use the defibrillator on a conscious patient asking questions. Option D, begin CPR and use the automated external defibrillator as directed. The correct answer is option D, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Question 58. Following office protocol in a busy front office, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, tilt the head far backward. Option B, pack the nose with contaminated gauze. Option C, lie flat immediately without assessment. Option D, sit upright and lean slightly forward. The correct answer is option D, sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Question 59. As part of exam preparation in a patient education session, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. First drops of urine into an unclean container. Option B. Clean catch midstream specimen. Option C. A random sample from an old urinal. Option D, specimen collected from the toilet bowl. The correct answer is option B, clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Old specimens may be contaminated and may not reflect current results. Toilet water contaminates the specimen. Question 60. After reviewing the situation in a patient education session, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, order random supplies without reviewing use. Option B, hide supplies from the provider. Option C, track usage and adjust par levels according to office needs. Option D, wait until every item is completely gone. The correct answer is option C, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Question 61. Given the workflow in a primary care office, the term cardiology appears in a referral. Which specialty is involved? Option A, heart and cardiovascular system. Option B, skin disorders. Option C, kidney disorders. Option D, digestive disorders. The correct answer is option A, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Gastroenterology focuses on the digestive system. Question 62. In a primary care office, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A, sinoatrial node. Option B, ureter. Option C, alveolus. Option D, gallbladder. The correct answer is option A, sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. Question 63. In a diagnostic testing area, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a normal calibration mark only. Option B, a properly grounded machine with still patient. Option C, poor electrode contact or patient movement. Option D, correct limb lead placement. The correct answer is option C, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Question 64. An office review in a diagnostic testing area shows that a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, ask the patient to jump to the table. Option B, lock the wheelchair and use proper body mechanics with assistance as needed. Option C, pull the patient by the arms quickly. Option D, leave the wheelchair unlocked for easier movement. The correct answer is option B, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Question 65. A medical assistant is working in a quality control review when a sterile package is torn before a minor procedure. Which action is required? Option A, spray the package with disinfectant. Option B, use the items if they look clean. Option C, tape the wrapper and use the contents. Option D, consider the contents contaminated and obtain a new sterile package. The correct answer is option D, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Surface disinfectant cannot sterilize items inside a compromised package. Clean appearance does not prove sterility. Taping does not restore sterility after the barrier is compromised. Question 66. After reviewing the situation in a family practice clinic, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, the fingernail bed. Option B, a reddened rash site. Option C, inside a visible vein. Option D, deltoid muscle when the medication and volume are appropriate. The correct answer is option D, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 67. While working in a walk-in clinic, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, clean and disinfect touched surfaces according to office protocol. Option B, open the door to air out the room only. Option C, change only the paper on the exam table. Option D, spray disinfectant and wipe it off immediately every time. The correct answer is option A, clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Question 68. In an internal medicine office, a pain score is being collected during intake. Which approach is best? Option A, assume pain level from facial expression only. Option B, Ask the patient to rate pain using the office's standard scale. Option C, tell the patient pain is not part of vital signs. Option D, change the score to match the assistant's opinion. The correct answer is option B. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Question 69. As part of exam preparation in a community health clinic, the provider discusses the function of white blood cells. Which role is most accurate? Option A, store bile for digestion. Option B, produce insulin in the pancreas. Option C, help defend against infection. Option D, carry oxygen as their primary job. The correct answer is option C, help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Question 70. When a patient encounter unfolds in an infection control audit, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, NPO. Option B, SOAP. Option C, PRN. Option D, RACE. The correct answer is option D, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. NPO means nothing by mouth and is unrelated to fire safety. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. Question 71. Following office protocol in a telephone triage workflow, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, painful or difficult urination. Option B, excessive thirst. Option C, difficulty swallowing. Option D, ear inflammation. The correct answer is option A, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Ear inflammation is otitis. Question 72. Before the visit continues in a primary care office, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A, ask the patient to drive to another clinic. Option B, complete all paperwork before telling anyone. Option C, tell the patient it is probably anxiety. Option D, notify the provider immediately and follow emergency protocol. The correct answer is option D, notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Potential cardiac symptoms should be handled through established emergency procedures. Administrative tasks should not delay reporting possible cardiac symptoms. Medical assistants should not diagnose the cause of chest pressure. Question 73. For a patient encounter in a clinical skills review, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A, matrix blocking. Option B, prior authorization. Option C, stream scheduling. Option D, wave scheduling. The correct answer is option D, wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Matrix blocking reserves time unavailable for patient appointments. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Question 74. Following office protocol in a phlebotomy station, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A, remove the band so it does not worry the patient. Option B, give medication first and ask about allergies later. Option C, ignore the band if the patient seems healthy. Option D, verify the allergy information in the record and with the patient. The correct answer is option D, verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergies must be checked before administration. Allergy risk is not based on appearance. Question 75. Given the workflow in a primary care office, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Use appropriate personal protective equipment and an approved disinfectant. Option B. Cover the spill with an exam table paper. Option C. Ask a patient to avoid stepping on it. Option D. Wipe the spill with a dry paper towel only. The correct answer is option A. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Question 76. When a patient encounter unfolds in a patient education session, the assistant is comparing two needle gauges. Which statement is accurate? Option A. Gauge has no relation to needle size. Option B. All injections use the same gauge. Option C. A larger gauge number always means a longer needle. Option D. A smaller gauge number indicates a larger needle diameter. The correct answer is option D. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge specifically describes needle diameter. Needle gauge varies by medication, route, and patient factors. Gauge describes diameter, not length. Question 77. After reviewing the situation in a certification exam scenario, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Schedule the patient for next month. Option B. Follow emergency triage protocol immediately. Option C. Give a diagnosis over the phone. Option D. Tell the patient to send an email later. The correct answer is option B. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Question 78. As part of exam preparation in a specialty referral visit, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Draw blood while alcohol is still wet. Option B. Allow the alcohol to dry completely. Option C. Blow on the site to speed drying. Option D. Touch the vein again with an ungloved finger. The correct answer is option B. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Question 79. The care team in a specialty referral visit asks for guidance because a patient says they cannot afford a prescribed medication. Which response is best? Option A. Notify the provider or appropriate staff so alternatives can be discussed. Option B. Tell the patient to stop all medications. Option C. Ignore the comment because finances are private. Option D. Suggest sharing medication with a friend. The correct answer is option A. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Sharing prescriptions is unsafe and inappropriate. Question 80. During a quality control review, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It is used only to schedule appointments. Option B. It allows the assistant to ignore provider orders. Option C. It communicates the patient's wishes about future medical care. Option D. It replaces all insurance forms. The correct answer is option C. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Scheduling is unrelated to the purpose of an advance directive. Care decisions still follow legal, clinical, and facility processes. Advance directives do not replace billing or insurance documents. Question 81. After reviewing the situation in a procedure setup, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A. Use it after expiration if it looks clear. Option B. Store it in a desk drawer overnight. Option C. Maintain required temperature storage and check expiration before use. Option D. Place it in direct sunlight to warm quickly. The correct answer is option C. Maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Room temperature storage can damage refrigerated products. Sunlight and heat can damage the product. Question 82. Before the visit continues in a medical office workflow, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A. Tell the patient fasting means no restrictions at all. Option B. Tell the patient to stop all diabetes medications without provider input. Option C. Cancel the test because diabetes always prevents fasting labs. Option D. Review fasting instructions and route medication questions to the provider. The correct answer is option D. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Fasting usually includes specific limits on food and drink. Medication changes can be unsafe without provider direction. Diabetes requires careful instructions but does not automatically cancel testing. Question 83. When a patient encounter unfolds in an administrative check-in area, a centrifuge is used in the laboratory. Which safety practice is important? Option A. Place only one tube at any weight in the rotor. Option B. Balance tubes before starting the centrifuge. Option C. Open the lid while it is spinning. Option D. Stop the rotor with a hand. The correct answer is option B. Balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Stopping a rotor manually is dangerous. Question 84. To protect safety in an infection control audit, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Loss of accountability for chart access. Option B. Better sterilization monitoring. Option C. Improved privacy protection. Option D. Automatic insurance approval. The correct answer is option A. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Passwords do not control payer authorization. Question 85. While working in a busy front office, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Listen respectfully and follow the office complaint process. Option B. Argue until the patient stops complaining. Option C. Delete documentation related to the complaint. Option D. Post the complaint online for staff opinions. The correct answer is option A. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Arguing escalates conflict and is unprofessional. Destroying or altering records is unethical and may be illegal. Publicly sharing patient concerns can violate confidentiality. Question 86. A medical assistant is working in a preventive care visit when coordination of benefits is needed. Which situation does this usually involve? Option A. A patient has more than one insurance plan. Option B. A provider orders a throat swab. Option C. A patient has one cash payment only. Option D. A patient needs a sterile dressing. The correct answer is option A. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. A throat swab order does not itself involve multiple insurance plans. One cash payment does not require multiple plan coordination. Dressing supplies do not create coordination of benefits by themselves. Question 87. During an administrative check-in area, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A. Ask a young child to interpret. Option B. Speak louder and slower in English only. Option C. Use a qualified medical interpreter. Option D. Skip the explanation if the patient nods. The correct answer is option C. Use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Volume does not remove a language barrier. Nodding does not prove understanding or valid communication. Question 88. When a patient encounter unfolds in an exam room, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Alcohol sanitizer is always illegal in clinics. Option B. Soap and water help remove spores more effectively from the hands. Option C. Hand washing is needed only before eating. Option D. Gloves completely replace hand hygiene. The correct answer is option B. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Question 89. At the start of care in a clinical skills review, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A. Verify the allergy information and enter it clearly in the medical record. Option B. Ask the patient to remember only prescription allergies. Option C. Remove allergies that the patient says happened many years ago. Option D. Place the form in the chart without reviewing it. The correct answer is option A. Verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Allergies to over-the-counter drugs, foods, or latex may also affect care. Past reactions may still be clinically important and should not be deleted without provider direction. Important safety information can be missed if the history is not reviewed. Question 90. The care team in a cardiology practice asks for guidance because blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Probe aggressively until blood returns. Option B. Gently adjust the needle position while maintaining safety. Option C. Label the empty tube as collected. Option D. Remove the tourniquet and continue filling all tubes. The correct answer is option B. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. Excessive probing can injure tissue and increase patient discomfort. A tube without the required specimen must not be labeled as completed. Without blood flow, the collection cannot continue effectively. Question 91. Before the visit continues in a family practice clinic, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Bladder. Option B. Gallbladder. Option C. Pancreas. Option D. Spleen. The correct answer is option B. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The urinary bladder stores urine, not bile. The pancreas produces digestive enzymes and hormones but does not store bile. The spleen is involved in immune and blood cell functions. Question 92. When a patient encounter unfolds in a telephone triage workflow, an electronic record uses an audit trail. What is its purpose? Option A. Sterilize instruments automatically. Option B. Measure blood pressure. Option C. Approve insurance claims instantly. Option D. Track who accessed or changed information. The correct answer is option D. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Payer claims processing is separate from record audit logs. Question 93. During an electronic health record review, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Encourage coughing and monitor closely. Option B. Leave the patient alone until they stop coughing. Option C. Give the patient food to push it down. Option D. Perform blind finger sweeps immediately. The correct answer is option A. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. Question 94. To protect safety in a telephone triage workflow, a medication is labeled for otic use. Where should it be administered? Option A, eye. Option B, mouth. Option C, ear. Option D, nose. The correct answer is option C, ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 95. The care team in an infection control audit asks for guidance because a subpoena for medical records arrives at the office. Which response is best? Option A. Ask the receptionist to summarize the chart from memory. Option B. Immediately fax the entire chart without review. Option C. Ignore it because subpoenas never apply to clinics. Option D. Give it to the provider or designated privacy officer for proper handling. The correct answer is option D. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Summaries from memory are unreliable and not an appropriate legal response. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Question 96. Given the workflow in a same-day appointment, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Leave the patient standing while searching for forms. Option B. Tell the patient dizziness is impossible. Option C. Assist the patient to sit or lie down safely. Option D. Ask the patient to walk faster. The correct answer is option C. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. Question 97. An office review in a treatment room shows that a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Record readings with date, time, and relevant notes as directed. Option B. Use another person's readings if the cuff is shared. Option C. Write only the highest number ever measured. Option D. Skip technique instructions because home cuffs are automatic. The correct answer is option A. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Readings must belong to the patient. Selective recording can mislead clinical decisions. Proper positioning and technique still matter with automatic cuffs. Question 98. After reviewing the situation in a primary care office, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Tell the patient to search online without guidance. Option B. Use clear language and review the key points with the patient. Option C. Use only complex medical terminology. Option D. Provide instructions in the wrong language. The correct answer is option B. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Language mismatch can prevent safe understanding. Question 99. At the start of care in an administrative check-in area, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Use the first visibly dirty drop for every test. Option B. Clean and dry the puncture site according to protocol. Option C. Puncture through visible dirt. Option D. Skip patient identification because the test is quick. The correct answer is option B. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Question 100. For a patient encounter in a busy front office, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A. Disable audit trails to speed workflow. Option B. Lock the workstation before stepping away. Option C. Share passwords with trusted co-workers. Option D. Keep the screen facing the waiting room. The correct answer is option B. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Audit trails support security monitoring and should not be disabled by staff. Shared passwords weaken accountability and violate security practices. Visible screens increase privacy risk.